question.
Good morning, Jorge.
Good morning, Jordi.
It's a real pleasure to have you here and to interview you. So my first question for you is, can you talk about your story a bit?
Well, it's a bit atypical, let's say. I'm a physician, graduated in Argentina by the 90s. Then I started a residency in pathology that I didn't finish because I moved to UK to do some studies on basic research, cortical development, nothing to do with muscles. And then I back to South America. I established in Santiago, in Chile, where I currently am. And I did my training in neurology. And then at the end of the training in neurology, I became interested in the neuromuscular field because of the connection with the histopathology. And after that, I trained in electrophysiology, peripheral nervous system, electromyography, nerve conduction studies, and then I did a diploma in Paris on myology, along with a training in histopathology of muscle. And since that time on, I get engaged with myology and all these things we do in the World Muscular Society and with the French, as I said, the French connection, the Institute of Myology and all that. And here I am now.
Good. So you're a very well-known, internationally well-known key opinion leader, but at the same time you represent a huge region like is Latin America.
Yes, it is.
And the reality is that when we talk about Latin America, we consider that it's the same reality in different countries. So today I would like to ask you some questions about the differences within Latin America in different aspects. For example, I would like to start with the health system, for example.
Well, although you may see Latin America as a region, actually, Latin America is a lot of different countries with different systems, different health systems, and in general, I can give you some impression, but obviously the detail of every country, I don't know it. I know it better from Chile, where I'm working now. But actually, Latin America is about 650 million people living in the same continent, mainly speaking in Spanish, with lots of people speaking Portuguese because of Brazil, which is a huge country. And the health system, it depends very, very much on the country. For example, in Argentina and Brazil, they have a very strong public system with some centers that are prepared for doing all the workup for a patient with a myopathy or a genetic problem, whilst in countries like Chile, the public system doesn't have much. There is no even one laboratory of muscle pathology. There is not one center on genetics, I mean on the public system or at national level. And most of the things go through private insurances. That is obviously a big difficulty because in general terms, you may say that the 20% of the budget is spent on the public health system, whilst the 80% is on the private one, in Chile I'm talking about, but the population affected by each of those budgets is exactly inverse. Let's say 80% of the people is in the public system, whilst 20% is in the private. So it's a huge disproportion. And on the top of that, for example, the National Health Service doesn't recognize as codified studies like an NGS.
Okay.
Or an exome or biopsy and many other things that are pretty much current for us and for doing our job. It's not recognized, so the patient has to pay from the pocket.
Okay. So in that scenario where there are some difficulties, of course, for patients to reach a diagnosis.
Absolutely.
What other challenges do you see for patients with neuromuscular diseases?
Well, the first challenge, and that's more or less even in the whole Latin America, is to find the right specialist. Because neuromuscular in general we are pretty few. And if you think on genetic problems in muscle and nerve, we are even less people working on that field. So in every country in Latin America, you will have also a big contrast between the big cities and the capitals and people that is living in other smaller cities. So even in Brazil, you can go to Sao Paulo and it's like being in Berlin or Paris. Whilst a few kilometers away from that, you are in the middle of the Amazon and there is absolutely nothing. So for that people to communicate with a big city, including some, for example, communication problems, because there are some tribes and people that are native and they don't have much knowledge of the official language of the country, is the first challenge is to find a specialist. If they have the chance to go to a university and to find the right physician, then the second challenge is to have the resources to do the proper studies, biopsy, the MRIs, whatever you may think. And after that is the costs, fortunately much lower now, of genetic testing. And at the end of that, when we cannot find, as happens a lot, we cannot find an etiology, for example, it will depend on the connections of that medical team, people in Europe, like the group in Newcastle or Paris or whatever else, that may do, let's say, an academic connection. But that will depend very, very much on the treating physician, and it's quite variable. And finally, in some other countries, like say Salvador, Costa Rica, Bolivia, there is almost nothing in the whole country. Not even in the biggest cities of each country, they don't have laboratories or groups specialized on the field.
So in the Congress, we are seeing many new therapies that are arriving to the field, right?
Yes.
And this is something that you see in this Congress and many other Congresses. What about access to therapies, for example, for patients?
In general, it's very poor, and frequently patients have to judicialize it. For example, in Chile, for adult patients with Pompe disease, the government doesn't recognize the treatment. So if you are an adult that has Pompe disease, it depends on whether you would like to go to a judge to validate the indication, and you will need to have a medic that will help you with that. Think on making certificates and to fight, to demonstrate utility of the treatment, for example. If you are in the private system, they have to cover the treatment, so we have at least two populations of people. If you are in the private system, they will access to it. It doesn't matter the cost, but if you are in the public system, it will depend on the judge, let's say, simply. And we, myself and all the colleagues, we have been on discussions with, for example, the Ministry of Health, and they is like talking to a wall, more or less, because they, I don't know which political reasons could be behind that, but they just say, they ignore the scientific evidence, and they put ahead all economic issues and things like that.
Okay, so you were mentioning that one of the challenges for patients is to find specialists in neuromuscular diseases. So for clinicians that want to become a specialist in neuromuscular diseases, what are the challenges that they face?
Well, alike. You need to access to a center that is prepared to give you some knowledge on it. We have pretty good connections with other countries to do more specialized training, but in general, perhaps Brazil could be an exception. In general, the training goes up to electrophysiology and sometimes a little bit of pathology on the field, not that much in MRI, for example. So we don't have centers that properly could address a complete training program for a myologist. That, by the way, is a kind of a new discipline in itself, because you need things from pathology, from MRI, from genetics, and so on and so forth. So what we do usually is that the kids or the students, the fellows, they go through neurology training, either pediatric or adult. Then they do a kind of neuromuscular or electrophysiological training. We call that perfeccionamiento, which is perfecting on the practice of. And then, depending on your networking, you may add to that a kind of a fellow done in centers like the one you are. You know that situation a lot because you have many fellows coming from all over the world, in Paris or in UK, Spain, a lot because of language for the Spanish-speaking people, and that's the way it is. I say Brazil is kind of exception, sometimes Argentina with Buenos Aires, because they have huge public health system centers with a kind of a number of patients, a number of specialists well-trained that can give the formation for the students.
But you have also pioneered on trying to network in the region, trying to also create, develop educational opportunities as well through, for example, Evelam, the summer school, or there is also Solane. Can you talk a bit about these initiatives?
Yeah, absolutely. I'm a teacher at the School of Medicine, and I like that. So that French connection I mentioned before, it comes through, is a bit funny because Dr. Norma Romero, which is one of our key opinion leaders since a long time ago, she's Argentinian, right? She was working at the time in the 80s with Professor Michel Fardot, who is another key opinion leader on the field and creator of, and who discovered many of the diseases we plainly told today as pretty common. At the time, didn't exist. So when I did my diploma in Paris, I get acquainted of all that people. Norma Andoni Ortiz Berea, which is French, but he speaks very well Spanish, and he travels all around the world, just developing and enhancing the education in myology in particular. And I think Andoni, Norma, they already had the idea of promoting those summer schools as the summer school in Paris. So at that time, we thought that it was going to be a good idea to do a summer school in Latin America in Spanish or Portuguese, just to approach the people in Latin America in the same language they speak, because probably in Europe, people don't realize that in Latin America, not everybody communicates well in English, even doctors. So it was a way of getting closer to the people speaking in the same language. So we developed this summer school that is 3-4 days of a very intensive course in myology. And we do that every year since 2008 in a different country of Latin America, of course. And if it is in the same country, in a different city. Mm-hmm. So just to try to grab more and more people. And we have done that, as I say, since 2008, with about 3,000 people that assisted to that school, just the students. On the other side, that's the summer school, which is for us literally school. It's not a congress. You will not send abstracts. You will be presenting sometimes your cases. And there is a complete course that goes from normal muscle to the latest news in therapy in neuromuscular disorders. And of course, is a little bit adapted to the reality of the country where we do it. Sometimes we put the emphasis in some issues that are particularly essential for a country. You have been in Ecuador, for example, in Quito, and they have problems with the phonoaudiologists and all that. So they did a workshop specialized on that to train people from Ecuador in a particular field. On another side is the Solane initiative, which is the Society of Neuromuscular, Latin American Society for Neuromuscular Disorders, an initiative of Professor Alberto Dubrowski from Argentina, who is pretty well known, working on the neuromuscular field since ever, actually. And he founded this Latin American Society of Neuromuscular Disorders, and every 2 years, a Congress of the Latin American Society is done, again in a different country as every Congress, but that is the concept of a Congress. We invite people that are key opinion leaders in every field, trying to cover all the field of neuromuscular disorders, not only myology. I didn't say so, but the summer school is focused on myology and some other genetic diseases mainly. Solane is just a neuromuscular congress, but for Latin Americans. Let's say is done in Latin America, not exclusively for Latin Americans. Everybody is invited, of course. And we do that every 2 years. Next year will be in Mexico City, actually. Last time we had it in Colombia, and so on. We try to network among us in Latin America. The summer school on one side and the Solane somehow are brothers, and we try to equilibrate the more academic and scholarship thing on the summer school, whilst the other thing is the Congress itself.
Good. So, as someone that is involved in organizing conferences that you just mentioned some at continental level, but also I know national level. So you deal with getting funding from companies. So now my question is about if you think that there is a change in how companies, pharma companies see Latin America, not only for educative activities, but also, for example, for clinical trials.
Absolutely.
Okay.
Yes, and I can tell you that has changed enormously. When we did the first level, for example, some companies that didn't exist at that time in the country, they were reluctant to do any support. They say, well, we are just started. Nowadays, they are asking us to participate, right? But also, things change permanently. Some companies are promoting a treatment that fails to be effective, so the next year they withdraw all the support in that particular disease or issue. And we are trying to move things along to engage other possibilities of funding, societies, and also networking initiatives like, for example, TreatMD. And on the other side, we work very hard to demonstrate that Latin America is a kind of a mine of knowledge that is unexplored yet. That implies that if we could know what diseases the patients have, we may enroll them on therapies and scale those ones to get trials, whatever type of knowledge you would like to develop. And another very important thing for us in Latin America is that most of the knowledge in many of those fields we move on are coming from Europe, North America, and in genetics we know pretty well that realities could be completely different. So it's necessary to enhance the knowledge to be able to perhaps to do some trials that will be more specific for the problematic of the region. Because, as I said, some diseases we cannot find them on the country, but we find a lot of others. So genetic reality is pretty different from region to region, even from country to country. So yes, one of the functions of those congresses and is to make awareness of all this.
And a bit beyond clinics, because you are also kind of a rara avis, if I can say, because you also have a lab, and then you do research in the lab. How is that reality in Latin America? So,
in general, again, with some exceptions, it's very, very hard. The idea of developing science with few resources is completely challenging. Even more, on my opinion, the mentality of many authorities that should develop some areas are not aligned with reality in scientific terms, I would like to say. So although they speak of promoting science, they are not successful on implementing those policies effectively. For us to get a grant, that usually there are one or two institutions that can found a grant in a country, is a nightmare of bureaucracy. You will say, I know, well, that happens all over. Yes, but it's a matter to me of proportions. Sometimes to justify just a ticket for coming to a congress like this, you have to do lots of papers and things that doesn't make really sense. When you get a grant, we have limitations of technology and resources, I mean physical ones, to analyze samples, to implement whatever you would like to say. What we do there is obviously we collaborate with other countries, but the drawback of that is that if we deposit all the specific technological things in other groups outside the country, we will never develop those. So it's a kind of tricky because, okay, we are happy for our patients to collaborate, but at the same time, we would like to develop things to be able to do them ourselves, including formation of scientists, medics, and you understand. So the case is a very, very fine equilibrium between collaborating and trying to develop things on in situ and also to convince authorities, even educational institutions, that it's worth going through that. And another good example for me is that, for example, we don't have registries. We don't know how many patients with Duchenne or SMA, and the registries come from kind of personal initiatives of colleagues that work on that. So if we don't know how many people is having something, it's difficult to justify how to investigate them and to promote their health.
But that's very interesting. So now that we are talking about number of patients and registries, so what we see is that patient associations, for example, have a prominent role and a growing role in how we deliver care, the research that we do. How is that in Latin America?
Again, it's heterogeneous, and in countries like Argentina, Brazil, you will have some well-developed. A good example is the SMA parents, families associations, that we call FAME, in Spanish, families for AME. And they are pretty well networked, and they do a fine job, but there are disparities on country to country too. Mm-hmm. And there is another big difference is when the disease affects the child, where the parents are promoting their healthcare, whilst you have adult patients that they have to promote their own healthcare. So that becomes more difficult because they have to struggle with the day-to-day life and to be able to get along with the work and family in countries that we don't have much disposition for disabled people. There are no laws sometimes. There are no facilities at all. So some associations have been created, but they don't yet have the weight you see some patients associations have in North America and Europe. So that's another challenge we need to face to enhance this participation, to explain to patients that the power they have is different to the one that we physicians have, or scientific associations, or even the industry, pharma industry, that they put pressure on governments, but when it comes from the patients themselves, it's completely different.
And my last question is, as far as I know, I think World Muscle Society, the Congress has happened twice in Latin America, I think.
Yes, in Iguazu and Mendoza, yes.
So, and what we see in general is when a Congress happens in a country or in a region, there is an increase in the interest in that disease. So what is the role that you think that World Muscle Society can have in Latin America?
I think there is a lot of potential again. We were going through the numbers of registries that World Muscular Society has in Latin America, and it's surprisingly low because we know lots of people interested on the field, but they don't belong to the society. So I think there is much space to collaborate with those already established initiatives and to try to do to potentiate both initiatives. I think World Muscular Society has lots to offer in terms of show how those things to collaborate with us. For example, the EVELAM is a group of neuromuscular friends that are developing a course. So the World Muscular Society has the know-how how to scale this kind of activities to what we see in those congresses. And also there is a huge potential of members, Latin American members, to be incorporated to the World Muscular Society. So I think it is one of those situations where we can talk of a win-win, because World Muscular Society, to be World Muscular Society, needs an extensive region like Latin America, and in Latin America we of course need all the expertise and know-how and the activities the society could promote.
So thank you very much for that. I hope that, I encourage you and your folks to present another application for having World Muscular Society again.
Absolutely. Thank you, Jordi.